Hi, my name is Maggie Kuiper, and I'll be demonstrating how to perform a central line dressing change. First, I would gather all my needed materials to perform the dressing change. Next, I would enter the room and provide patient privacy. Next, I will perform hand hygiene. I will begin by introducing myself to the patient and identifying the patient using two patient identifiers. I would ask them their name and their date of birth, and then I would verify this in the MAR on the computer. I would also verify that I have an order to perform the central line dressing change itself. Next, I'll begin by placing a mask onto the patient and having them turn their head away from the central line. Next, I will begin by putting on clean gloves. I would also wear a mask myself. To remove the old dressing, I will move from the outside towards the line to prevent pulling the cord out itself, the central line itself. And I will hold pressure on the line to prevent it from extending. Gently will pull away from the skin. While I'm removing the dressing, I'm going to assess around the access site for signs of infection, swelling, drainage, or tenderness. I will also note the marking of where the central line was first placed and if it has moved since being placed. I will discard of my old dressing along with my gloves. I will then perform hand hygiene. Next, I'll begin by setting up my sterile field. I brought a separate pair of sterile gloves as well that I'll be placing over here. I'll begin by opening up my central line dressing change kit. I will open the kit away from me to prevent contamination, since everything inside of the kit is sterile. During this time, I would continue to have the patient look away from the line since it is no longer covered. Inside the kit, there is sterile gloves already, which I will not be using, so I will discard of. I will remove my sterile field dressing, drape, and gently open it, only touching the exterior 1 inch. Next, I will don my sterile gloves. I will be sure to not turn my back to the sterile field to prevent contamination and maintain sterile. Okay, so now that I have my sterile gloves on, I will keep my hands above my waist to prevent contamination. I can now remove the items from my sterile kit. Gently, I will remove the item and place it onto my sterile field. I'm going to place the things that I need first closer to me and the things I will use later in the back. This is my dressing that I'll be placing onto the patient, and I'm going to go ahead and already open it halfway. Okay, so to begin, I will have one dirty hand that I will be holding the line with itself. My left hand will be my dirty hand, and my right hand will be sterile. I'm going to hold the line and prepare my cleaning. This is a chlorhexidine alcohol swab. Shake it. I'm going to clean from the interior to the exterior in a C circular motion. Making sure to clean the skin around the site as well. Next, I will clean the line itself, moving outward and without touching the skin that has already been cleaned. You can use this tool to agitate dried debris that is around the central line itself. We'll discard of this into my waste. I can now let go of the central line since it has already been cleaned, and I no longer need that to be sterile. This hand is still clean, so I can pick this up off of my sterile field, and still remaining as sterile as possible, I will open my dressing. Touching the exterior 1 inch, I will proceed to place the clean dressing over the central line. Some kits have biodiscs that you place around the access site, but our Tegaderm for this video is impregnated with chlorhexidine already. I will then remove the external part of the dressing, and this contains the sticker that I will initial and date. I will then sign and date the sticker and place it onto my clean dressing. The patient can then remove their mask and they're ready to go. Thank you.